Hey y'all, Amanda Windenberg here, coming at you with our last video of our Nursing Leadership and Management class 4502. I hope y'all are as excited as I am. We're one step closer to getting that degree, and thank y'all for being my audience. I'm going to start my presentation now on quality improvement. So my interview process, the name of the person I interviewed, her name is Amanda Lee. She is one of our senior charge nurses, that's her title, and the date of the interview was April 17th, obviously 2018. And then the place of interview, First Health Hope Conference Room. So based on your interview, what were the concerns brought up by the QI representative? So our biggest thing that we are trying to focus on right now, excuse me, at Hoke, is to reduce the number of patient falls. That is our biggest thing, biggest concern right now in our emergency department and medical surgical floor. Out of the quality care problem issue / gap in care discussed during your interview, what were the top priorities? So again, the top priority is going to be providing safe care to our patients and preventing falls. We want 0 falls. We do not want any patient to fall at our facility. Describe the quality improvement initiative and why it's important. So obviously our #1 goal is to reduce patient falls throughout the ED and med-surg. It's important because we don't want anyone to get hurt. Patient safety is our top priority. Our QI initiative consists of, it's a couple of different things, so I'm just going to start at the top. So we want a staff member to remain in the bathroom with any high falls risk patient that's getting up and ambulating to the bathroom. We also enable bed alarms on all of the beds at 2200. We provide patient education, including reiteration of falls risk during bedside report. Staff education is a big one, including communication of falls risk to interdisciplinary care team members. Staff engagement, we post blank weeks, days, months since our last patient fall. We want that to see months. We don't want to see days. We don't want to see weeks. We want to see months. Those are a couple of our QI initiatives. A couple more. So a staff member is going to sit with any confused patient, especially a patient that's trying to climb out of bed. We really utilize the paramedics a lot for this. When they don't have any calls to go on, they will come and sit with our confused patients. So we greatly utilize them. Careful screening during the triage process of a high falls risk patient, as well as when the patient gets admitted to the back. We want to make sure that we didn't miss that over in the ER, because all of our patients who are admitted from the emergency room. So we implement a falls safety contract with all of our patients upon admission to the floor. It's a piece of paper that they sign stating that they will not get out of bed without calling us, and we have every single patient sign that. Bedside report in all departments, that is across the board. Leadership rounds every 2 hours. They come through the ED as often as possible, but they try to do it every 2 hours. And then on the acute care side, they again try to come every 2 hours. We also put gray armbands on all of our confused / demented patients, and this helps to alert the staff from different areas of the hospital that this patient does have a history of confusion. We also have a falls bundle that we use, and that consists of a yellow bracelet that we place on the patient's wrist, yellow socks that we put on their feet, a yellow blanket that we place over the white bedspread, and also a yellow magnet that we put on the outside of the door of the patient's room. So what evidence was used to determine that quality improvement was needed? Obviously, because we had a fall, we never want a patient to fall. So that's what we base our evidence on, as well as looking at the Indian QI, the National Database of Nursing Quality Indicators. Perspective of how it impacts the organization and the mission of the identified facility. So having a patient fall in a facility looks bad for the organization. First Health strives to provide safe patient care to all patients, and having a patient fall can be detrimental to them, to their family. It can be a very big burden. First Health's mission statement: nurses at First Health provide a continuum of family-centered care focused on innovation and exceptional quality. Using the RCA and FEMA guidelines, conduct a mock review of your facility and summarize your results. So patients are falling due to improper identification of falls risk, miscommunication between team members, staffing shortages, noncompliance with First Health's fall policy, and high patient acuity. Explain what goal the initiative is trying to achieve. Again, we're trying to achieve 0 falls. What national standards are being met by addressing the initiative? JCAHO, the 2018 hospital safety, patient safety that we are going towards is using alarm safely, as in using our bed alarm safely. And also NDNQI, our associates are professionals with deep healthcare experience and are strongly committed to our client success and mission to reduce suffering. Which quality indicators will be used to measure the improvement in the initiative? A decrease in patient falls, 0 patient falls, reviewing all patient falls, incident reports so we can see the event surrounding the fall. Describe the quality indicators and how they support the initiative. So obviously a decrease in patient falls will lead to less harm to patients. 0 patient falls is our goal that we're attempting to achieve. And we review all patient falls to try to help determine the cause and the outcome of each fall. Explain who collects the data and how they compare it to other data. So an RN will fill out the falls incident report. That then goes to our leadership team. They do their review, and then that goes to More Regional, our main hospital, who then submits it to NDNQI. Determine the agencies they report their information to. More Regional reports to NDNQI. Determine nursing's involvement in helping with the initiative. So we encourage all nurses to attend the HOAC Unit Council to give their input on the Falls Initiative. Ashley, she is our patient safety nurse champion. She gives hour-long education falls prevention steps to all new employees, as well as a monthly class that she tries to rotate through. Nurses are to adhere to the fall safety policy at all times. Nurses are to hold each other accountable. First Health has a just culture, which allows for reporting of errors without having a blame. We are a blame-free organization. If you see something going on, we mention it, but there is no blame. We don't blame each other. We try to help each other. Decide who else is involved in the initiative / multidisciplinary roles and modifying. So First Health HOAC has a no-pass call-out policy. It doesn't matter if you are the lab, staff, nutrition, or the CEO. If there's a call-out going off, you go in there and check it out and see what's going on. Explain some of the challenges in your workplace in meeting the goals, so staff members not being compliant, not giving bedside report, not properly identifying a high-risk falls patient. Make recommendations on how nursing can alleviate some of these challenges. Education, proper communication, collaborative care, precepting our new staff members in accordance to our policies. Who would you need to involve in order to suggest change? Go up your chain of command. Charge nurse, nursing manager, nursing director, and then finally the president of our facility. What can other departments do to assist with modification? Again, communication across the board. Radiology lets us know when they take a patient and when they bring us back our patient. How would you go about involving other departments? Like I kind of said, in the emergency room, multiple departments work side by side. When respiratory is done with the treatment, they be sure to let us know, hey, I'm hooking them back up to oxygen. You may want to check on them to see if their O2 sats rise. It's all about communication. Describe your timeline and budget. So the timeline to implement our entire fall system, we're giving it a year. We have a budget of $100K. What do you hope to accomplish with this modification? Our hope is to have 0 patient falls. How will you evaluate the outcomes? Obviously, we'll evaluate the number of falls in 2017 versus the number of falls in 2018. And I hope y'all liked my video. Sorry I felt a little bit rushed. We're getting to the end, and I thank y'all so much for watching. Y'all have a good rest of your weekend, and call, don't fall.